The Ministry of Health has submitted 32 herbal medicines for testing to find a possible cure for COVID-19 at the Center for Plant Medicine Research. Deputy Director for the center, Dr. Alfred Apia, says over 60 individuals have also sent their samples. Currently, testing is going on at various stages, but the Ministry of Health is yet to make any financial inputs. Ghana spends less than 0.4% of its resources on research, and the WHO adds Nigeria has the highest investment in herbal research.
The U.S. stocks, which had been plummeting, actually received some revival on the 13th when some level of information on a possible vaccine was announced. So the industrial stocks and the medical stocks actually went up on the Dow Jones, and as much as 8% rise in those stocks. Fast track them, these issues to Ghana. One of the things that has been spoken about is the fact that our preparedness when it comes to medicine has been missing, and less than 0.5% of our resources are actually put into research. And here at the Center for Plant Medicine, virtually no amount of money has been coming here from the central government. I have come here to find answers as to what herbal drugs are being used, or the sort of research that has been going on when it comes to herbal drugs and possible solutions for COVID-19. So how do these rats come into the COVID-19 conversation?
Yes, let me start from this point. I think we are all aware of the fact that as we speak now, we don't have a medicine that kills the coronavirus, right? So what is being done globally is that we are doing what we call repurposing. Through WHO and other scientific organizations, certain drugs that are already in the system have been selected, which are known to have certain properties, antiviral properties, and which have prospects of being helpful. And those drugs are being used, and they are monitoring its effectiveness. One of the drugs that have popped up is hydrochloroquine. I'm sure you might have. A few other drugs, yes, have been done. And similarly, if you take herbs, there are known herbs that have antiviral properties. And there are herbs that treat diseases like chickenpox, measles, shingles. And these are viral diseases. And there are herbs that treat these conditions. The implication is that these herbs have antiviral properties. And there are herbs that have been worked on scientifically with known antiviral properties, right? So what we are doing is to look at
the range.
Yes, a few of these, pick a few of them, and then retest. Look at what they can do so far as antiviral property is concerned. And
so are you introducing, for example, the COVID into these mice and then using these drugs? Exactly how then does it connect?
What we are interested in is a herb that have a potential to do something so far as COVID-19 is concerned. But we are not experimenting with that virus. With the coronavirus, this novel coronavirus, you need a specialized lab to do that kind of work. Currently, WHO will not allow us to do that one. But you can experiment with other viruses in collaboration with our collaborators to confirm the antiviral property of a particular herb or of a particular product. And that, in addition to information on the herb in literature, we can indicate that it is possible that this particular herb or product can be of use in this disease condition.
How many drugs have been brought by the Ministry of Health to you?
We received a total of 33 products from the Ministry of Health, and we understand it came to them through GAFTRA, Ghana Federation of Traditional Healers. So they brought a total of 33. But as at now, other individuals have also brought some, and we have way above the 33 that the Ministry of Health brought.
The Center for Plant Medicine says that, well, they stopped counting the number of people that throng into their center every single day, claiming to have some level of drugs to help cure the that's COVID-19, and they stopped the count at 60. And just as you have seen in my shot, these gentlemen from Koforidua have also come in with some solutions. But the need for scientific centers to be resourced in order to work with the speed that is needed for an emergency, this does not exist right here. And these are some of the critical things that we will need to get solutions for pandemics like this.